For the past 2 weeks, I have been rounding in the hospital as the attending physician in a nephrology consult service. So today, I will share a few tips on how I try to round efficiently. A typical day in a consult service will have about 25 to 30 patients in the list, and usually we will have about 2 to 5 new consults in a day. So how do we try to remember the whole list? How do I try to round efficiently? So this is what we're going to talk about today. To give you a little bit of context, because I work in an academic hospital, I also work with a nephrology fellow or a nephrology trainee, but there are times where I work independently. So tip number 1, I usually get a verbal sign up from my colleague a day before I start service. So what I mean is usually we take turns rounding in the hospital. As I start in the next 2 weeks, I usually make a phone call. We spend about 1 to 2 hours talking about the whole list from the prior week so that I know who is sick, who needs to be seen, and what other things I need to be watching out for. This process, even though it takes 1 to 2 hours, it is so worth it because the next day I would have known, the whole list already, and I don't have to worry too much about going through each chart individually, trying to figure out who I need to see first. Tip number 2, try to create a one-liner for each patient. So what do I mean by that? When you first start seeing a patient and when you have 25 to 30 patients, it is not efficient to try to go too much into details of each patient because you're not going to remember everything. What you want to do is really look at the big picture, know only the key points, and over the next week or so, you try to layer in all the additional details for each patient. So an example of a one-liner is like this. Mrs. So-and-so is a 48-year-old patient who was admitted for heart failure, and nephrology team was consulted for acute kidney injury. Currently, the kidney function is getting worse, and today we are going to see the patient to determine if she needs dialysis or not. So now it is a one sentence where I know who this patient is, what sort of bad condition they have, why they are here, and finally, why the nephrology consultant is seeing this patient, and what we're going to be watching out for. So that is how you start with the skeleton. Number 3, see the patient without pre-rounding. So this may seem counterintuitive to you, but it is really much more efficient that way. So let me share a personal story. The biggest mistake I did when I was a trainee nephrology fellow was I spent too much time on the computer looking up all the details of the patient. And I would write copious notes on sheets of paper and all the details of the patient. And the problem was, after the 25th chart, I would have forgotten about the details already, and I don't remember who is who. And this process would take me 2 whole hours because, even if it's 5 minutes per patient, when we have 30 of them, it would take me that much time. And so by the time I saw the patient, maybe things would have changed, patient may have gotten discharged, or maybe labs have come back. Finally, the worst thing is when I have to write the note later, I will still have to go through this whole process again. So why do the double work? Instead, I will go straight to the patient. And at the door, right before I get in, I usually pull out my phone and check the labs so that when I talk to the patient, I can examine them and go through the labs with them. Sometimes I even pull it up and show them the trends so that they know what's going on with their numbers. Now, for patients with ICU and can't talk, what I do is I will ask the ICU nurse, anything happened overnight? And in the room, I will also look at the drips, machines, vent setting during that time. That is a lot more efficient than looking through the computer chart to figure that out. Number 4, memorize special features about my patient. So when we go into a patient's room, we definitely need to think about the medical side of things. But if we do that too much, patients will start to blend together, and I don't want that to happen. When I see a patient, it is a special moment where I am building a connection with them. So I will pause and memorize a special feature or story about the patient. Usually it can be their pain point. Some patients they like to joke about, and I would remember the joke. Maybe they talk about their family members, and I'll try to memorize that feature. Basically anything that makes them unique from a non-medical point of view. You may ask, how is that more efficient? Because you are taking more time talking to them, asking about their family. It makes them trust you better. That's number 1. And number 2, now you know your patient better. When both of you know each other better and trust each other, you don't need to constantly check the chart to remind yourself, oh, who's that patient again? And when the patient sees you, you don't have to keep telling them the whole story again. And they know, okay, you are the kidney doctor. You're here to see the numbers, and they're just going to ask, oh, how are my numbers? How's my kidney function? So to me, that actually made it a lot more efficient. Number 5, choose the sweet spot to round. So this is very field specific or institution specific. After some trial and error, I found that the sweet spot was between 9:15 to 10 a.m. I need to start rounding around that time. I know that because by that time, all the patients who needed dialysis will be at the dialysis ward, and so they will be there. I just need to go one place. All the labs are back, the ICU attendings have been rounding, and also the nephrology fellow would have had time to see the patient and also get some updates. Now, number 6, write notes efficiently. Here, at this time, I will finally, after rounding, I would sit down and start charting and writing down the notes. And at this point, I will take more time going through the details, going through other attendings notes and see what has been written and lab results. One thing is, do realize that the purpose of hospital notes are to communicate with other teams and documentation for billing purposes. So it does not have to be the best note in the world. Instead of writing prose of long paragraphs of what the patient's going through or the plans are, sometimes it's just easier to write down the points and pick up the phone and go through it with the team. That's much more efficient. Because I work with a renal fellow, I usually look through their chart, I review what they have written to check for accuracy, make sure they are writing the right assessment and plan, and make sure they meet the billing requirement. Finally, once I'm satisfied with the note, I will addend and also sign off the note. Some additional tips, I try to use as many templates as I can so that I don't have to keep using, so that I don't have to retype it again. If labs have been pre-populated into the chart, into the note, there is no reason to retype it. I'll just say labs reviewed. Finally, I try not to spend more than 5 minutes per note because if you can imagine, 5 times 30 patients means 150 minutes, 2.5 hours. So you want to spend more time with the patient, not more time sitting at the chart typing. Number 7, what about teaching rounds? How do I fit in teaching throughout all of these? So I like to teach as we round, usually as we are walking together. Usually I'll be asking, okay, what's the differential diagnosis? How do you troubleshoot? What's your plan at this point? If give different scenarios so that they can think through the answers. Usually I plan for 2 sitting teaching rounds in a week where we are dedicating maybe 30 minutes to an hour on a topic. That way the fellow has time to prepare their reading, and then I can also talk about the things that they want. Typically, teaching round, clinical round, and note writing will be done by 2 to 3 o'clock. And once that is done, I will go back to my clinic to do all the administrative work, such as billing, answering emails, maybe calling patients, and occasionally do meetings with my research team. There are times where I have to do meetings in the middle of the day, and I would have to break off, attend a meeting, and then come back to write the notes. One question I get sometimes is, do I do research work during hospital service or when I'm rounding at a hospital? Typically no, because manuscript writing is it's a very cognitively demanding task for me. I need uninterrupted time, I need quiet, deep focused time. So even after I finish my notes around 3 o'clock, I would still get calls, I would still get new consults, so I can't have that interruption when I'm writing. So what I usually do is just plan for research administrative work or some meetings just to maintain the research work, but not to generate papers. So there you go. These are the 7 tips on how I try to round efficiently as an attending physician. I'm going to start doing more videos about life as a doctor. So if you want more videos like this, please put in the comments below on the topics you want me to cover. I'll see you in the next video.